Welcome to Staying Connected, a podcast where I talk to other people about their stories with VEDS or vascular Ehlers-Danlos syndrome. Hey everyone, and welcome back to Staying Connected. This is your host, Katie, and before we get into the show, I want to remind you that the views, information, and opinions in these podcasts are those of the individuals involved and do not represent the opinions of the Marfan Foundation. The Marfan Foundation is not responsible for and does not verify for accuracy any of the information contained in them, nor does the information constitute medical or other professional advice or services. This show is not produced by or affiliated with the Marfan Foundation or the VEDS movement. In the last episode, we talked to Charlene Terrell Newman, who lost her son Luke in October at the age of 15. Charlene told us Luke's story to raise awareness of VEDS in an emergency and honor Luke and his desire to help other people with VEDS. In today's episode, the last episode of this season, we're going to hear from one of the amazing doctors and researchers in our community, Dr. Shaine Morris. Shaine cares for many people with VEDS, and I'm so grateful to have her as an advocate in our community. Before we go over to the interview, if you want to support the show, consider joining my Patreon. For a few dollars a month, you can make sure this show continues to reach people around the world with real-life stories about VEDS. You can join the Patreon at patreon.com/translucent1, and you can also support the show by sharing this podcast with people you know to help us raise awareness of VEDS together. Really, anything helps, and this podcast is actually reaching a lot of places around the world. It's awesome. So thank you so much for your support and raising awareness of VEDS together. Let's go ahead and go to the interview with Shaine. Hey Shaine, I'm so excited to have you share your story on the podcast. I've really wanted to interview you for a long time. And why don't you go ahead and introduce yourself to the people who don't know you?
Hi, so I'm Shaine Morris. I'm a pediatric cardiologist, and I'm currently practicing in Houston, Texas at Texas Children's Hospital, which is the pediatric hospital that's part of Baylor College of Medicine. I run our cardiovascular genetics program, which has a focus on connective tissue disorders, including vascular EDS.
And how did you get involved in this space to begin with?
Well, it's a little kind of a long story. So going way back to high school, I had wanted to be an engineer, and then I had this fantastic biology teacher who inspired me, and I just wanted to be a geneticist. And through high school and college, I joined genetics labs to sort of do research. And the genetics lab I got in was a Marfan lab. And I really loved it. And I went on to medical school to be a geneticist. But then the person who ran my lab was a cardiologist, and I thought what he did was amazing. So I decided to switch my career, decided to cardiology, but I always had this passion for genetics. But it kind of died down a little bit. But after I had become a pediatric cardiologist and I was doing extra training in imaging, people knew I loved genetics and said, well, hey, why don't you kind of combine this interest in genetics? Why don't you do some Marfan imaging projects? And I just got really back involved in the space and still loved it. And when I came on faculty at Texas Children's Hospital, they said, why don't you run our cardiovascular genetics program, which was a perfect fit for me because I'd done genetics for decades at that point. And so I was really seeing a lot of patients with Marfan syndrome. And I think just the word started to get out, and I started having more patients come to our clinic with Loeys-Dietz and vascular EDS. And then I just really was drawn to the vascular EDS community, just their strength and the rarity and how little we knew. And so then I've just really been involved with that community since starting in faculty here.
Yeah. So why don't we talk a little bit more about your involvement, like with the community? How many families do you care for roughly? And, what has really been impactful about that?
Sure. So I think I probably have about 30 to 35 active families. I think we have 70 people that are involved in sort of our research program, but that includes the parents and aunts and uncles. And so, it just really, just their passion to find an answer really drives me. And I mean, every family I meet is really interested. I think they are really excited to be in a place where we understand VEDS, we understand the challenges. And I think it's just a symbiotic relationship. It's a little challenging. We have days where we see a lot of VEDS patients and they go till in the evening because we can't stop talking with each other. And I'm learning what's new and they're learning what's new. And I think it's just this really strong connection, and as a pediatric cardiologist, we're trying to help their kids live happy, healthy lives, but as safely as possible. But we're also trying to make sure that the extended family members are getting the care they need and the connections they need.
Oh, that's wonderful. So tell me more about the research that you do.
Sure. So we have a lot of active research projects in vascular EDS. And so my training as a researcher, so I'm a what's called a clinical outcomes researcher. So that means you take a disease and you try to figure out what are the risk factors for negative outcomes, like for death or dissection. So that's different than a lot of people in this space. So a lot of people who study genetics want to know what causes genetic problems, right? So like Dr. Byers is, one of the forefounders of figuring out why we have vascular EDS, what's wrong with the collagen. And so that's most people in genetics are sort of what we call etiology researchers, right? People who discover genes, people who discover gene modifiers. And so I'm really different. I'm a trained epidemiologist. So I study rare diseases and how do we predict the outcomes, and then how do we use the knowledge we have to prevent outcomes or improve outcomes. So I sort of take that look on VEDS, and that's really different than a lot of people. So our research is, we want to enroll as many families as possible. And obviously, as a pediatric cardiologist, I have a focus on children and young adults. And we sort of say, one of our big research projects is looking at all the imaging and saying, is there anything from the MRIs and the CTs and the echoes that helps us figure out who has more fragile vessels, who doesn't, who do we have to restrict, who don't we have to restrict, who do we have to worry about. So one of our projects is using vascular imaging to predict outcomes. We do a lot of perinatal, so around birth, pregnancy, and newborn research. Is there anything we can tell from the newborn period to help detect VEDS, or if we know they have VEDS, that we think might have better outcomes? We also look at things like bone density. And then we also look at risk stratification. How can we if a 5-year-old walks in, how can I say, you're not at risk for 10 or 12 years of an event, or like, oh, we probably have to watch you a little closer, watch you a little tighter. So it all has to do with sort of predicting outcomes to kind of be more informed and know who's a better candidate for certain therapies as they come.
Yeah, that's really interesting. So this idea that something that really popped out at me when you were talking is this idea that not everybody has the same exact risk. Like there's variations within our community to keep in mind. That's a really great concept, because I think a lot of people really I just think of myself and like exercise, and how much I used to love exercise. And then when I was diagnosed, I found all this scary stuff online about what I shouldn't do, and like very strict restrictions. And then I meet other people that were like, oh no, my doctor told me this, or my doctor told me this. And there's so much variation there.
Well, there is. And we know, exercise is a great example of it's huge for mental health, right? Especially in children and young adults. It's a huge part of people's daily lives. It makes you feel better. And like I see kids that are diagnosed, I have a whole family and they're all motocross and they all have VEDS, and they don't have a null mutation. And I don't know how they did that for so many years, and they still do. And then you have other families, that have an event really early in their life, or someone in their family. And how do we really, rather than, it's not just mutation, right? There's other things. And can we better understand so we can help reassure families? It causes so much anxiety and stress when you get a diagnosis, but I don't think we shouldn't diagnose people, but can we better risk stratify?
Yeah, I love that. So if people want to get involved in your research, do they have to live near Houston, or how do people get involved?
Absolutely not. And actually the pandemic helped with that. Our hospital used to have restrictions where to do this kind of research, we had to examine you in person or get a special release that we can examine your records, but you still had to be a patient of our hospital. But it's totally changed. So we can do everything virtually now, which is great. We don't have we'd love to examine people if we can, but we don't have to. So our biggest project now, so we just started a huge project called Clarity, and it's VEDS and Marfan and Lowe's-Dietz, but it's at it's 30 programs in the United States, and plus the Canadian group is now going to join us, plus a group in Russia and a group in Pakistan.
Wow.
And yeah. And we're collecting patients. We're hoping to get as many possible. And what we're asking for is medical records, right? Medical records, and then probably interviews to really get the information we need. And then we'll know what outcomes they have. And we'll look at the past history of things that have happened. And then we'll follow everyone going forward. And we hope this is in perpetuity if we can keep getting it funded. But we're funded for the next few years. perpetuity so we can follow people along. And so this is one of the ways, which is neat because I mean, all the major hospitals and pediatric hospitals in the country are contributing. So we're really excited.
That's wonderful. So how does somebody sign up for that?
So they can just email me, or I don't have my research coordinator's number handy. We're going to call it Clarity. We're going to get an email handle for Clarity, and our Clarity website, which is Clarity Registry, is going to go up soon, but it's not live yet. So for now, shainem@bcm.edu can email me. You could email the Mark Fund Foundation to email me, but we can get people registered. And the way that it'll work is that you can either register with us directly. If you register with us directly, we can interview you. We can call you back. We can request your medical records. You can also register through your hospital. The hospitals have the choice, though. They can either get all your information, but that's pretty hard work. Like it's pretty laborious for each hospital to do a lot of consents, and not everyone has the funding and research staff to do that. So we give them the option to just for us to extract records, but they have to get permission. So it's a little more, depending how your hospital has elected to do it. People do it in different ways. They may not get as many detailed records depending on their staffing, or you can enroll directly with us. Either way, yeah.
So I'll put that information like in the podcast description.
That'll be
too,
perfect.
So
yeah, and it's just gotten rolling. So I think we have 3 hospitals have their ethics boards and consents all set up. But it's, every week we're getting more hospitals that have the program set up. So
that's incredible. And I think, so it seems like, now, especially with the clinical trials coming up, and then also like this Clarity study, we've got a natural history study. It just seems like research has kind of exploded for veds right now. But does that like give you hope, or how does that make you feel?
Well, definitely. I mean, one of my specialties is studying rare disease, but it's hard, right? You can't, if you have 10 patients, it's really hard to understand how their different features affect outcomes, right? But if you can get 200, it can really help you understand. And the great thing about being recruited from these pediatric institutions is most of these are like super wonderful hospitals that are doing all the right things. And if we can get all the actual imaging studies and their medication information and everyone's contributing, it's just really, really helpful. And I think all these centers, pediatric cardiologists are this funny group, like we're not surgeons, we're children's doctors. And so most people are really passionate, and it's really great that everyone wants to contribute, and it definitely gives me hope. And I think all of these other people want to know how to help their kids too. So.
Well, that's super exciting. And I'll be sure to put that information in there. So if you're listening to this, like there are so many opportunities to get involved in research now and coming up in the near future. So, keep in tune to that. I think, to Shaine's point too, when you have 200 people, it gives you a lot more answers than when you have 10. So the more people that enroll really makes a difference.
And Clarity is enrolling up to age 45 because we want to do pregnancy outcomes. We're working with Dr. Russo. So it's not just for kids, it's also for their parents and other affected people, and anyone who's even had a pregnancy, been affected by a pregnancy, been pregnant with someone with VEDS, if anyone sort of affected by VEDS that was touched. You can even enroll if you're 50. We just would take your information from 45 and below. So it's pretty wide open.
That's wonderful. So as a specialist like in this area that cares for a lot of families and people with VEDS, what is something that you would want emergency medical professionals to know? I think that's a big area that we're still really working on in this community.
Yeah, I mean, the first thing and most important, I think everyone's community knows, is that VEDS is different than hypermobile EDS and the kind of EDS that everyone is familiar with. Hypermobile EDS is so common. So one, to know it's different. And recognizing it's different, I think we really need to make sure to be listening to the families. And so I think, it's hard and it's busy, and you think you've seen this before, but this really is a really different condition. And when the families say something's wrong, to really pay attention, and also to really listen to the providers, reach out to who their pediatrician, their cardiologist, their geneticist, their vascular surgeon, whoever the family says, hey, could you call this person? Because this is a scary condition, and these families have been working usually through this for a long time, and they sort of know when something is wrong. So I think mainly listening to families, and don't being afraid to reach out to their primary person, whoever that is, to sort of help guide diagnosis, treatment, and therapy.
Thank you. And I think, we didn't talk about this before the interview, but along the lines of, listening to the families and calling their specialist or their primary point of contact, what kind of advice do you have for families who are trying to put together their care teams? Like, what does that look like?
I mean, I don't think the care team needs to be a particular special type of specialist. There are ones that tend to gravitate towards this kind of care, but I think someone who listens to you and is willing to advocate for you. So, that could, again, I mentioned that could be a cardiologist, a geneticist, a vascular surgeon. I think in peds, it tends to be the pediatric cardiologist. And in adult medicine, it tends to be the vascular surgeon or the geneticist. But I think anyone who really cares and is going to answer the phone and is going to advocate, I think that's the right person. And you still have other people on your team, but sometimes you just need someone to listen.
Yeah, definitely. Well, thank you so much. Is there anything else that you would want the listeners to know about you, about VEDS, about your involvement?
Well, I think one other thing is when we're talking about treatments for VEDS, I think people in the emergency room and surgeons and providers, when they do realize that VEDS is different, I think it's really scary, and they're very worried that they're going to do something wrong if they do some sort of procedure or they do some sort of intervention. And we still get people calling saying, we think the person needs this, but maybe we shouldn't do it. And just to remember that all the same procedures, all the same things can be done in VEDS. We just have to be careful and thoughtful, and you shouldn't decline treatment or be afraid of treatment. It just has to be done with the family, with the provider, and thoughtfully. But we're seeing phenomenal outcomes now, and I think 10 of my patients have had some sort of surgery in the last 5 years, and they've all done great. And so it's just changing that mantra that we try to not touch them at any cost, of just going through this treatment programs thoughtfully.
Thank you so much. I really appreciate that.
Yeah, no problem. And I guess the other thing is just to really keep talking with your provider. We learn from you, and I know it's hard. Sometimes you think that doctors have all the answers, but in these rare diseases, I'm so happy. I mean, I think people in the VEDS community understand this, but it's really important to advocate and say, hey, I see a difference. Hey, I see a pattern. Hey, can you tell me more about this? Or, hey, could we work on this together? I think that's how we learn. And, we don't have a lot of the answers in VEDS yet, and we need to figure it out, and just keep working with your doctors. Don't worry about, asking lots of questions. Don't worry about advocating, because I think that's how we're gonna move forward.
Yeah. I really totally 100% agree with that. It is challenging and frustrating as somebody with VEDS to continually have to be that person to keep pushing. Sometimes is difficult. You just want to stop. Sometimes you're just I don't want to fight anymore. I don't want to. But being your own advocate, or if you're a parent, being an advocate for your kid, if you know something is wrong, you have to advocate for yourself, because there's so many, this is a rare disease, and not everybody knows about it. So
that's right. And we're trained in medicine, to be all knowledgeable and to help families through and to guide them. And we do that our best. And it's also this default for most things. We know a lot more than the patients, and we know way, way more because we do this every day, all day. And it's also an instinct as a physician to be I know more than you, because usually we do. But in these conditions, you just have to, realize that a lot of clinicians you see that's not going to be the case, and it's going to have to be teamwork.
Yeah. And so then for the clinicians too, that open-mindedness when you're approaching somebody with a rare condition that maybe you don't know all of it yet is mutually beneficial to everybody, I think. Well, thank you so much, Shaine, for coming on the podcast. And I'm just so grateful to have you as part of our community and really involved with us. It is a tight-knit community, and you're in it with us. And I love that.
Oh, well, thanks. I'm really excited to be part of the community. And I really do see my patients as part of our family. My whole family knows all about VEDS, my kids. And I'm just really excited. I do feel like I'm part of the community, and it's really an important part of my work. So
thank you.
Sure.
Thank you so much, Shaine, for coming on the podcast and for your dedication to our VEDS community. And thank you, everyone, for listening in today. If you want to get involved in the Clarity study that Shaine talked about in this interview, you can email her research coordinator, Nadia. I've put Nadia's contact information in the description of this episode, and soon there will also be a website for the Clarity registry. When that is available, I will add that to the episode show notes as well. I want to take a moment to thank all of the medical professionals who are listening to this podcast and learning about vets. Our community truly needs you, and I appreciate you taking the time to hear our stories. This is a wrap for this season, and I'll be hosting interviews over the summer for a new season in the fall. So stay tuned and don't forget to subscribe to Staying Connected on your podcast player so you don't miss any of the future episodes. If you like the show, I hope you will consider sharing it with your friends on social media to help us continue to reach people around the world and raise awareness of vets. I can see so many people listening from so many different countries, and it is truly incredible. So thank you. If you want to, you can also support the production of this podcast by joining my Patreon at patreon.com/translucent1. Big thank you to my first patrons who have already joined and are supporting the show in this way. Thank you so much, everyone, and I will see you soon.